Hello, I'm Vicky Pleydell. I'm Clinical Chief Officer of the CCG, and I'd like to welcome you to this video and to our website. The CCG is the group of local GPs, and our job is to basically buy healthcare for the patients that live here. So it's about improving quality, working really hard with the people who provide healthcare to make sure we have really good healthcare for people who live in Hambleton, Richmondshire and Whitby. Before the CCG, decisions were made by what we call the PCTs, the Primary Care Trusts, and they were groups of managers who worked to try to do the best for patients. The government decided that actually it was important to put clinicians in charge, and so CCGs were born. And what that means is that every decision that's made now is made by clinicians, by the doctors who provide healthcare, and what that gives us is a real understanding of what healthcare means for patients. As a CCG, we set out to be really different. We wanted to be a group of people who actually really went out and talked to the public, who understood what their issues were. And so we've started by having a very different conversation, by going out there and saying to people, what is important, what do you care about? So rather than saying this is what we want to do, we're saying actually what do you want us to do on your behalf? And actually working with the public is really crucial for us. So it's about how you get engaged, and we have lots of ways that you can do that. We have the website, we also have our health engagement network, and that's a membership organisation where you sign up and you can then choose how much involvement you want to have. You can just get newsletters, or you can actually come and be part of some of our working groups to change services. Well, we've had lots of success, I think, and I think I'm bound to say that on time, but I think that actually the biggest thing is that I think we have a coherent story now about the kind of healthcare we all want in this area. I've lived and worked in this area for 25 years, and I think what we've got now is we all agree. The public are with us, we've listened to the public. Our story then is about the kind of healthcare that we want. And in the first year, we've actually managed to deliver some of those changes. Not all of them, and it's a long journey, but we've made the first steps. So we've got more nurses in the community, we've got more physiotherapists, we're keeping more patients at home who no longer need to go to hospital for things. We're doing more in GP surgeries. So the first part of that vision has been delivered. One of the real challenges that we face is that so much of healthcare and social care is fragmented. And I think we all understand what that means for us. My mother is 94 and has dementia, and she has many people come into her life every day who she finds confusing. Social workers, social carers, district nurses, continence advisors, GPs, and actually we need to join this all up. To do that, the organisations have to work together, so we have to work much more closely with social care, with the voluntary sector, with all these services, so we wrap them around the patient, and from the patient's point of view it all feels joined up. I think our aim for the CCG for the next 12 months is to continue on our journey, to develop more, to keep more patients out of hospital, to make sure the care they get is joined up and patient focused. And I think to do that, we have to invest in those services, and we have to work very hard at changing the culture, both in healthcare and in social care. We want to develop the Friarage Hospital so it becomes a beacon of rural healthcare, something we can really be proud of into the future, and we want to make sure that it's safe for the future, and that will mean change. So this is all about working with clinicians, working with the public in partnership to really change things. Thank you very much for watching this video. We're really keen that you get involved with us. As clinicians, we really want to work jointly with the public. It's really important to us that any new things we put in place have you alongside us. Thank you.